Hi, I'm Will King, CEO of MPSC. Our device HeRO is a new vital sign for NICU patients that uses heart rate variability to predict and assess inflammatory events like infection, allowing for earlier diagnoses, more effective treatment, and improved outcomes. HeRO acts as a surveillance system that identifies abnormal heart rate patterns that often precede infection. Every hour, for every patient, HeRO calculates a score that quantifies the degree to which these abnormal patterns are present and displays the score so clinicians have an early warning of deterioration. The HeRO score was tested in multiple studies, including the largest randomized control trial ever conducted among premature infants, where 3,000 very low birth weight babies were randomized to either receive standard of care or receive standard of care plus HeRO. We found those patients with HeRO experienced 20% decreased all-cause mortality, 40% decreased mortality after infection, improved antibiotic targeting, reduced length of stay, and reduced cost of care. Please join us at the HeRO Whiteboard as we explore the device and the medical research that supports its use. Click on the like and subscribe buttons to make sure you don't miss any episodes as they are released, or contact us directly at info@heroscore.com. The time for HeRO is now.